Welcome to the JOMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Hi, my name is Rebecca Friedman. I am a fourth-year medical student at New York Medical College, and I'm here with the JOMA Specialty Spotlight podcast. The Specialty Spotlight podcasts are geared toward pre-med and medical students interested in learning about different medical specialties. Today, I will be talking to Dr. Ilana Margulies. Dr. Ilana Margulies is a PGY5 integrated plastic surgery resident at MedStar Georgetown University Hospital in Washington, D.C. She completed her undergraduate studies in biology with honors at New York University and then completed a master's in biomedical sciences at the Icahn School of Medicine at Mount Sinai. She then earned her MD at New York Medical College with Global and Population Health Area of Distinction and was inducted into the Alpha Omega Alpha Honors Medical Society. During medical school, she pursued a research fellowship in plastic surgery at the Icahn School of Medicine at Mount Sinai. She has authored over 30 peer-reviewed publications and has presented at numerous conferences. She is also very involved in the resident advisory board of the Plastic and Reconstructive Surgery Journal and the Jewish Plastic Surgeons Forum. She hopes to pursue a career in general and complex microsurgical reconstruction. When out of the hospital, she enjoys spending time with her husband, 2 daughters, and golden retriever. Good morning. Thank you so much for joining me today. So I wanted to begin with asking you a little bit about medicine in general. What initially inspired you to pursue a career in medicine? And also, were you always interested in plastic surgery, or was that kind of a journey that took you some time to figure out?
So I didn't always want to pursue a career in medicine, even though I grew up surrounded by it. My father is a general surgeon. My mother is a rheumatologist. My brother is a general surgeon too. I didn't always intend to go into medicine. In fact, I was initially drawn to human behavior and thought, at the beginning of college that I wanted to be a social worker or a psychologist. And I spent, many of my college years like taking psychology courses and like doing internships at like psychiatric rehabilitation facility. And then I became curious in the underlying, physiology of mental illness, and that led me to explore science and biology. And then I, from that, developed a love for biomedical research. And then after college, I decided to do a master's in biomedical sciences to explore that more at the Icahn School of Medicine at Mount Sinai. And I did my research there studying drugs on to improve kidney transplant rejection. And while I loved this, I volunteered in the hospital at the same time, largely in the geriatric emergency department there. And that's when I kind of realized I loved, even more. I loved that human connection and the vehicle for compassion that kind of clinical medicine allowed. And that's when I ultimately decided to apply to medical school. Um, and then in terms of like my love for surgery, that kind of started developing a little bit around the same time when I went on a couple of medical missions with the Chester Children's Hope Foundation and my father. And I had the opportunity to see operations and see him operate. And that's when I kind of realized I loved surgery. I'd never been in a situation before where I kind of lost all sense of time, where it was kind of this experience that like hunger and exhaustion completely disappeared. And, 3 hours passed in what seemed like 20 minutes. And I was like, man, I love this. I want to do this every day, have my day go by so quickly because I'm like so enthused by what I'm doing. And so that's when I was like, man, I think I love surgery. And then, the plastic surgery component kind of came in around the same time, a little bit later, when I started experiencing plastic surgery operations. And I kind of loved how plastic surgery was this, vast field that combined, intricate operative techniques and this creative thought process that I didn't really see anywhere else. That in order to come up with like the best operative approach and for each individual patient, while taking into account both aesthetic and functional considerations to improve their quality of life. It was something that I found was incredibly unique with regards to the goals of plastic surgery and kind of everything around it, operating head to toe on so many different kind of processes throughout the body. Um, And I was inspired by that transformative impact that plastic surgery has, not on every patient's like medical well-being, but also on their like quality of life. And I felt that that was a kind of a really unique component of plastic surgery. You know, with plastic surgery, it's like everything from like breast reconstruction for women with breast cancer to hand and peripheral nerve surgery to head and neck reconstruction. We kind of really combine all of these kind of aspects of kind of operative techniques and in order to improve both aesthetics and functional goals. And I found that that was like very, very inspiring. um, Something else that I love about plastic surgery too is its emphasis on innovation. I think that that kind of, and I'm sure that you've experienced that in your research here too. It's, I feel like everything in plastic surgery is constantly asking questions about, how can we do this better? How can we improve what we're already doing? And it constantly is this kind of fundamental drive that I think advances our field to like an extreme capacity. And that's why you see like, the people first person to do a kidney transplant was a plastic surgeon. You
That's
think about,
fascinating.
yeah, I know, it's amazing. We just have this kind of, and I think that maybe it's the field that attracts the people, or the people that kind of makes the field. It's hard to figure out if the chicken or the egg, but that's when you kind of see there's so much advancement in our field happen over kind of a relatively short period of time. I'll give you just one example is, I think about the advance something I'm love is microsurgery. So think about the advancement of microsurgery over the last 40 years. It's just phenomenal. When, 40 years ago, we were thinking about, oh, which tissues in the body are supplied by which blood vessels. And fast forward, 40 years, we are not only know that information, we have refined those operations, we connect those blood vessels together so that we can move tissue from one part of the body to another part of the body. We can troubleshoot any problems that exist with blood clots or spasms or anything that might happen to those like, millimeter blood vessels. And then we, discharge these patients within, a day or two after having breast reconstruction with adequate pain control and confidence that our operation is going to succeed. It's so cool to see that kind of innovation constantly happening. And I think that that is something really unique to plastic surgery that, is really exciting to be a part of.
That's so fascinating, and I have so many comments for all the things that you said. But I want to just kind of go to one area, and then we'll go back to kind of getting into the field and all that. But I'm just curious, when you talked about like your psychology background or being interested in the behavioral side of medicine and people, and then going into plastic surgery, do you feel like there's any kind of bridge where you kind of get to see both of those things together?
Yeah, there's a lot of, I think, psychology that happens in plastic surgery, just because I think the emphasis and the problems that we deal with in plastic surgery are so related to the way that people live and, the quality of life that they have, as opposed to maybe just, solving, a one problem. So many or the one like medical issue, like so
Yeah.
many things that we do are like, how can we optimize, the aesthetics of this, or how can we make your function better, for hand surgery patients. We've shown so many time and time again that hand surgery and function after hand surgery relates to psychiatric well-being. um,
Yeah.
think about like a breast cancer patient who has gone through breast reconstruction, the kind of psychological well-being they have before and after having that reconstruction, in the journey of their cancer is just so profound. And I think that there's so many things that, intertwine there that, you're totally right that, perhaps that's also why I decided, that this is what I want to do, is because it allows me to kind of apply surgery in that capacity.
Completely agree with that, and that's one of my favorite parts about plastic surgery as well. Just like there's such a focus on function and quality of life and like improving like living outcomes, not just like did we get the tumor out or did we connect the correct vessels. Like all of that is obviously important, but there's also such a focus on how is the patient going to feel afterwards? Like how is the rest of their life going to be? How are we going to make their lives better? I think that's such an amazing part of plastic surgery that I don't think you really get to see so much elsewhere. So thank you for sharing all of that. So now I just want to bring it a little bit more back to how you got into medical school, what was the journey like, and then a little bit about getting into residency as well.
Yeah, so my I applied to medical school after or I guess during this the last year of my master's program in biomedical sciences at Mount Sinai. And, thankfully, I got into New York Medical College. It was a great, fit, both, in terms of what I felt from the school and kind of the culture of the school, but also the location of the school. For my husband, who at the time, also wanted to go to rabbinical school in Riverdale. And so that's kind of where we set, where we, decided to live for the next, 4 or 5 years of medical school. So that, process, I think that, coming from the biomedical sciences program, there was a nice avenue to apply to medical school. I think many people, my classmates in that program, either decided to apply to medical school or decided to apply to a PhD program to continue research. And so I think that they had those avenues and kind of that guidance set up very well, which, was very nice. And then in medical school, I think that the challenge that I had in medical school was that there was no kind of plastic surgery home program. So when you're applying to plastic surgery, being involved in, an already existing program is really important. It allows you to kind of, see, number one, what plastic surgery is really like, to,
Mhm.
get involved in cases, get involved in more research, meet, the faculty. Plastic surgery is a very it's a close knit community of people. And so getting to kind of learn from those people early on in your medical school education is really valuable in that journey. And so, I think that folks like, myself and yourself who come from places without those home programs, without that kind of culture and without that, community already set up can be more challenging. Thankfully, Dr. Zellner, Elizabeth Zellner, had just become faculty when I was a second or a third year medical student. And I remember I saw her email in a grand rounds. She was going to give a grand rounds on something related to plastic surgery. And I saw that email that, that we get, on our
Mhm.
general emails. And I was like, oh my God, I have to meet her. So I was on my like third year clerkships. I was walking down, the hallway in the basement of Westchester Medical Center. And I see her and I'm like, wow, you're down. Hi, Dr. Zellner. Like, my name is Ilana Margulies. I'm really excited about plastic surgery. Can you help me? And she said, of course, just this wonderful human being. And so, thankfully, I had that interaction with her and she was so kind. And, it was because of that, that she then, set me up with, to meet with one of her colleagues at Montefiore at the time, and who then kind of referred me to Mount Sinai because he had seen that Mount Sinai was, having their first research fellow or interviewing for their first research fellow. So I interviewed for that position with Dr. Taub and, thankfully I got it. And I had an amazing research year in between my third and fourth years of medical school at Mount Sinai. And I think I really attribute a lot of my understanding of plastic surgery, my love for the research in plastic surgery, to that research year and the mentors that I developed at Mount Sinai at that time. And I think research years are great years to do. You learn. Not only do you do research, and you're able to, obviously build your CV, gain, experience writing and presenting, but I think it allows you to explore plastic surgery in a way that you don't really get to otherwise. You get to, delve into topics, really learn about things. And I think it allows you to almost use research as an avenue for your own education. And I think I
Mhm.
really, used that year very well. And, I worked really hard during that year and I loved it, and was able to gain, amazing mentorship that I'm extremely grateful for from, Dr. Taub and the faculty at Mount Sinai. And from then, I was able to then do kind of AIs after that, sub Is, and apply to residency afterwards. And thankfully, matched at Georgetown, which was, my top choice in my where I really wanted to be, because number one, it's a fantastic program. I love the culture here. I love the faculty here. I love the breadth of plastic surgery that we get to see. I think it's some of the
Mhm.
best training that I could hope for. And then also, having, a daughter at the time and, my husband, and knowing that I wanted a larger family, I wanted to be in a place where that could be supported. And we're both from the DC area. So I think that from a, aspect of supporting my family, this was, the ideal place for me to be.
That's amazing, and it's so nice to hear the whole progression, and I'm sure it feels amazing to be where you are now, so, but it's very helpful to learn from, kind of the whole process, and I will agree with you on the research here. I think you don't really get a lot of time to delve into any particular subject in medical school because you're just kind of going through everything and trying to get a little taste of everything, but on a research year, you really get to delve into all the topics, really experience every different, area, learn so much more than you would have in medical school if you got like a 2 or 4 week rotation, like an elective. So I agree. I think it's a really great experience for anyone who's interested in that. So going back a little bit again to just getting into medicine in general for our listeners, is there any particular trait that you think is necessary for a career in medicine?
Yeah. I think that the most important trait is to honestly to be a good person, and to want to do the right thing. I think that medicine is so unique because these are like, we're talking about people's lives. It's like, the life of a patient could be the life of like my brother, my mother, my child. And it is such a profound responsibility that we have, to take care of people. And I think that the motivation behind that always has to be doing the right thing for the patient. And that's not necessarily true in any other profession. Like some professions, you go into finance to make money, or you do
Yeah.
things that are motivated by different things. But I think when you're in medicine, as much as medicine has so many different aspects, so many different components. There is a business aspect to medicine. There's a prestige aspect to medicine. There's accomplishments and all this stuff that happens within this medical community that makes it multifaceted and interesting. But at the base of all of that, I think the most important thing that, you have to keep in mind, and that has to be your motivating factor, is, you know, doing the right thing for the patient and always trying to be kind of the best, most ethical person that you possibly can be. I think that's kind of, in my mind, the most important part of kind of what drives me on a daily basis, and that I think what should drive everybody, who's in any kind of career in medicine. I think that, hard work is really important. So having kind of a work ethic, especially in a surgical residency, is really important. Surgery is hard. We spend a lot of hours in the hospital. We do a lot, from intern year to senior resident. You're constantly like, you're working really hard, and oftentimes, away from your family in the hospital for long hours. And you have to be okay with that. And I don't think you have to
Mhm.
be okay with that, but that has to be something that you love. You know what I mean? Like, you have to love what you do. Otherwise, you're just not going to be happy. So there has to be
Yeah.
whatever you choose, whether it's medicine and surgery or whatever aspect of that, you have to really, really enjoy it. And I think that if you do, people say, like, if you love what you do, you won't work a day in your life. It's the
Yes.
same thing, but kind of like magnified, or like multiplied, because we just spend so much time working. So you just
Yeah.
have to like not consider it work. You have to think it's fun. So I think that that's kind of like another quality that's really important, not only for having you be able to do a good job at what you do, but also be happy with what you're doing. Then I said the last thing I think is humility. I think that particularly in surgery, having humility and being able to recognize, that there's always room for you to improve, and there's always something that you can do better, and being able to critically look at your mistakes and be like, here's what I did wrong, here's what I need to do better the next time, is so
Mhm.
important. Because especially with something like surgery, you're constantly you're doing a ton all the time, both in managing patients and in operating. And everyone, you're obviously bound to make mistakes. That's why we have a morbidity and mortality conference. It's a universal thing in surgery. And so this idea of like, looking at, critically, how can I do better? How can we do better? Having that humility, having that vulnerability to take a step back and say, you know, what can I do so that the next time I encounter this situation, my patient can be safer, my outcome can be better, I think is extremely important. And it's sometimes hard because we all like to be confident. We all like to think, oh, we're doing a great job. But I think being able to like accept that vulnerability, and being humble, at the same time, is just so critical.
That's really interesting, and I think that's maybe something that isn't spoken about as much, like, and we just actually had somebody come for grand rounds, and one thing he talked about a lot as well was being self-aware and how important it is to be, as much as all the great things that you do, also being able to like step back and say, okay, where can I be better? Exactly like what you're talking about. And yeah, I think that's not really something so discussed, especially like when you're talking about getting into training. It's all about like working hard, which is also important and all that. But it's interesting to hear that that aspect. And you kind of touched upon this already, but I would love to hear a little bit more about how you've managed balancing life between residency, obviously working many long hours in the hospital, and having a family life. You mentioned daughters, and I know you have two kids, so I'd love to hear more about that.
Yeah, so I had one child in medical school. My husband and I got married when we were juniors in college.
Nice.
And then I had one child in medical school. After a while of trying, we had a lot of trouble conceiving our first daughter. And we were seeing a reproductive endocrinologist at the time. I wanted to have this daughter early, or this child early on in medical school. And, we'd gone through a couple rounds of COVID, and at that point, I was just like, we got to stop. At this point, I'm 9 months away from step one. At the end of second year, it's like, this timing is so bad. Let's stop. Let's take a break. And then lo and behold, that was when we actually conceived our daughter, which is this like miracle, like this like Nishamai
Wow.
moment. And
Yeah.
like, oh God, so now here I am, going through my second year of medical school pregnant, and I took step one and I was like 35 weeks pregnant. And I was like so grateful that this experience worked out in my favor, because it could have
Wow.
gone so poorly in so many ways. And so thankfully I had her. I took, I think, 5.5 weeks off after that to for maternity in between having her and starting third year, which, third year, I don't even remember how the schedule was set up, but I started my third year with my surgery rotation, which is obviously like the most
Oh,
important
wow.
rotation. And I was like,
Yeah.
oh my God, of course I'm starting my surgery rotation with this like newborn, this like 6 week old
Mm.
newborn. And I was like,
Oh
I
my
gotta, I
gosh.
gotta, I gotta do well. I gotta get a high grade. Like I want to go into surgery. And yeah, I just had such an amazing support system. My husband was so supportive. My parents and my in-laws, I think they came in up to New York almost every other weekend to help
Oh,
with
wow.
the baby, so that I could have enough time to not only like sleep and be sane, but study, so that I could do well on my shelf, so that I could get a good grade,
I
in
cannot imagine.
in that in that rotation. And I think that support is just so fundamental, and that support is kind of what
Mhm.
has driven me and allowed me to do this, with not only my first daughter, but then having my second daughter during my second year of residency. Having my husband be so supportive, and having our families in particular nearby to help, has just been, helpful in a way that I can't express. So I think that is what really has allowed me to kind of be able to do this, and, help to, make sure that my husband feels supported too. And do it in a way in which my kids are happy as well. I think that the other, of course, good time management is really important. So, being able to use all of your time at home effectively, and,
Mhm.
so that you can, be present as a, mother, and then also, go to work and, do the best job that you can as a resident. I think that's really important. And then I feel like the final thing that I think is really important is just your attitude. It can be hard to be away from your children and maybe miss things that are really critical. Come home late, miss dinner, miss bedtimes, and that's like not, abnormal. It happens for sure. Cases run over, particularly as a, surgery or plastic surgery resident. But I think that, this attitude of, doing all of this, number one, being really happy and, satisfied and fulfilled with what I'm doing. I hope to some degree, is shown my children what it looks like to do something that you love in life and work really, really hard at it, but feel so good about what you're doing. Feel like you're doing something good for the people around you, for the world around you. And I think that there is value in raising children that way, in raising children where, you have parents who are living that life. It's almost like, implicit versus explicit parenting. I'm not even sure if that's like a real thing, but like the explicit parenting is like being there and like teaching them, saying like, here's what to do in this situation. But
Mhm.
there's, I think, value to showing them what that looks like, to showing them what
Yeah.
it looks like to wake up every morning really early, come home late at night, be so exhausted, but so in love with what you're doing, and so in love with how you're able to help other people. And, I think that that's the way that I grew up with, watching my dad, wake up every morning the same way, come home late at night, be so exhausted, but so in love, and still loves what he does, still operating, still loves surgery. And
Yeah.
think, and not that I hope that my kids go into medicine or surgery. I they do whatever, my parents told me when I was a kid, they don't care. It didn't care what my brother and I did as long as we were happy, healthy, and did something good for the world. And that's the same thing I hope
Great.
I hope for my children too. Um, but I hope that they watch me, and they grow up and they're young, they're only three
Yeah,
and seven at this point, but I hope that they watch me do this and they take value from it and they kind of use that and use that in as they strive to do whatever they want to do in the world, but they use that as a model for how to engage with something and how to strive to work hard at something and to love what you do and to do something good. And so I think that it can be hard, but I think there can be a lot of value to this.
that's really beautiful. I really like that perspective because I think a lot of times people focus on how hard it is or how much time you're missing or, the negative part about being away, which of course is hard. But if you can kind of think about it in a way that's beneficial to you, your children, like showing them the good side of that and why you're working so hard. And I think like everything you talked about is a really beautiful perspective that I wish was also talked about more. And so kind of shifting a little bit on that topic, what is the most rewarding part of being a plastic surgery resident and what is the most challenging?
So I'd say the most rewarding part is just getting to be able to help people with these really complex problems that ultimately hopefully improve their quality of life. So to help somebody with lymphedema, doing lymphatic reconstruction and seeing how their limb then starts to shrink and how they're able to maybe wear a little bit less compression, and go out to dinner without having to compress their arm, and how special that experience is. Or you've talked about the impact on breast reconstruction, or lower extremity reconstruction. Somebody who has had a car accident and has an open fracture, and we're able to cover that, and then that 20 something year old is able to go back and play basketball. Those kinds of experiences where you're able to kind of tangibly impact the way that somebody's able to function, and get back to what they love doing. I think is probably the most rewarding part of what we do.
Mhm.
um and then, it's hard to think about like the most challenging part. I think you could say, of course, it's challenging to, do what we do because, I'm not gonna, I won't sugarcoat it, and that, surgery and residency, it's all challenging. Um, I think that it's also, I think that in my mind, one of the most challenging things, and I've kind of alluded to this before, um, is just dealing with the magnitude of what we do. Being operating on somebody every day, and really, this person, could be my mother, my sister, my brother.
Yeah,
And, I think that that magnitude of, what we do by like literally opening somebody's body, they're entrusting us to fix
yeah,
a problem. When so many things could go wrong. There's so many, if you think about like the possible complications of every operation, even though those, percentages may be low, they can happen. And I think that, the magnitude of dealing with that I find to be challenging sometimes. And it's hard, it's almost like balancing that. It's not a fear, but it's kind of a realization of what could happen. I found, I think at the beginning of residency to be almost like paralyzing, and that
hmm,
anxiety of like, oh, what if I do something wrong? What if I make a mistake? How do I deal with that? How does my conscience deal with that? I
yeah,
thought that those challenges of kind of working through those scenarios, that was hard. I think the more that you do it and the more that you get through those things, the easier that becomes. And the more, obviously, the more experienced you get, the more that you see. But I think that, maybe that's a challenge that should always be there, right? Because we should always be thinking about, the magnitude of what we're doing in surgery and in medicine in general. Um, but I think that, that has been something I think that has been particularly challenging for me throughout residency. But
that's also
I don't honestly, thinking about it now, it's like I don't necessarily hope that that gets any easier because I think that's what keeps it, it keeps us humble and keeps us kind of striving to do better.
that's what I was going to say. Kind of comes back to that humble, self-aware aspect that we were talking about before. But do you feel that with just confidence, the more operations that you do and learning more as you go through training, have you found that to be a little bit easier, like just progressing through? That's
Yeah, absolutely. Absolutely. The more that you do, and that's why I think, I'm so grateful to be at Georgetown where we just have so much operative experience. We do so much, our case volumes are like, extraordinary. The depth and breadth of what we do is so great because, I think that doing things multiple times, seeing them done in multiple ways by different attendings, being taught differently, all of that kind of like multifaceted education really helps you kind of understand, how to get from point A to point B, how to do something, but in a way that can be 50 different ways, and by by doing that and by seeing that multiple times, I think that really helps you kind of understand more and be more comfortable with whatever it is that you're doing.
That's really fascinating. Um, what is one misconception about plastic surgery that you would like to clear up for listeners? And I think plastic surgery is one field that's a little bit more obscure in medicine, so I'd love to hear your thoughts on that.
Yeah, it's funny. I think that people just don't understand the breadth of what we do, especially when it comes
Absolutely.
to, yeah, the lay public, for example, like people, like if you ask, the majority of people, they'll be like, oh, plastic surgery is cosmetics, is aesthetics. And that's a very big and important part of what we do. And, it's definitely important, but it's definitely not all of what we do. And I don't think that people realize that plastic surgery spans from, we are the only surgeons that operate head to toe, from birth to elderly. We do hand surgery, we do craniofacial surgery, we do reconstructive surgery of all parts, all over the body, all tissue types, all kinds of defects. Um, we do aesthetics, we do lymphatic surgery, microsurgery. We do, it's just so much. And I think that even, even people in the hospital, I don't think, other, maybe referring internists or whatnot, don't really understand that, we do a lot of a lot of things, and we
Yeah.
operate in a lot of areas that are really impactful. And that's why I think, plastic surgery again is just so exciting because there's just so much that we are trained to do. I think it's probably one of the most difficult fields to master because there's just so much to master. There's so much anatomy to know, there's so much
Yeah.
technique to know. But I think it also is what makes it so exciting because it allows, once you know more, once you've operated in more places, once you've seen things in different ways, you're able to then apply and to innovate. And I think that's what makes us, again, back to that kind of unique aspect of plastic surgery as these
Mhm.
innovators. That's what allows us to innovate because we're in all of these areas, we're thinking about all of these things, we're, constantly questioning, and that, doing all of that by not being siloed to one area, that's what allows us to say, oh, maybe we can apply this to that. Maybe we can do this
Yes.
better by borrowing from that, and I think that is the one kind of thing that people just have a misconception about. People think, oh, plastic surgery, we, do breast augmentations and we do facelifts and we do rhinoplasties, which are all very important. And I love those operations and I think that they're incredibly impactful. But
Yeah.
it is definitely not, the whole of what this field offers.
Yeah, I that's what I thought about plastic surgery before I got into it and learned how much more there is. And I agree, it's just such a fascinating mix of everything. And like the fact that I love the fact that you can go head to toe and find something different that you can do, and every operation is something different too. It's all so unique and really tailored to that patient, whatever they need. And I just think it's such an incredible field, and I wish people knew a little bit more about what it actually is. But leading into my next question for you, so I know that you're interested in microsurgery, and I'd love to hear more about that journey and how you chose that, aspect of plastic surgery and what you plan to do in the future with that.
Yeah, so I love, microsurgery, and I started kind of in residency and seeing different parts of plastic surgery. That was, going back to that idea of like, oh, you can be in an operation and hours go by in minutes and, hunger and exhaustion disappears. That's those are the operations in which I really felt that happen. Where like, literally it'd be 6 or 7 hours later and we'd be in the middle of this, flap and I'd be like, oh my God, wow, it's already like 3 p.m. I had no idea, I didn't even, my
Yeah.
mind didn't register it because I loved what was in front of me so much. Like this idea of, mastering this anatomy, identifying, this flap, dissecting it out, doing the micro. It's so technical, it's so interesting, and, just makes you think so much about the anatomy of the human body, which I think is just so fascinating. So I loved I love that experience. And then, even more so, I loved everything around it. I love the, preoperative planning, thinking about, well, what does this patient need? How can a flap or a type of microsurgical operation help this patient? When thinking about flaps, we think about, multiple different areas of the body that you can take tissue from. What are the pros and cons of taking it from one place versus the other? How can we optimize this flap to give this patient a better function, better aesthetics? There's just so many considerations that I find to be incredibly creative. It's interesting because it's so the opposite of so many other things in surgery that are like, oh, here is a problem. You have cholecystitis. You need a cholecystectomy. You know what I mean? It's A, B. But here there's like problem A and like, A to Z plus, possible solutions. And you're like, oh, it's just so interesting to think about. I love the medical complexity of some of the, of the patients who have to undergo some of these operations, figuring out how to optimize them. I love, thinking about that and figuring out kind of the medical aspect. How can we optimize this patient for like a very complex operation, which oftentimes, patients may need. And then afterwards, thinking about the post-op care, flap assessments after, we do these surgeries, how is a flap doing? How can we, think about, how it's doing, and being able to kind of clinically look at the development and the progression of, flaps after we do them. And then also like, I think that even more so like the application of microsurgery is not just with regards to flaps, but like thinking about things in which we've been able to apply them, like for example, like lymphatic surgery. Now we're doing, operations to improve patients who have lymphedema, or also to prevent lymphedema. For example, for patients who have actually lymph node dissections and have to, have the lymph nodes kind of removed from their axilla, and have those lymphatic channels cut. Now we're at a point where we're saying, oh, maybe we should be immediately at the time in order to prevent further development of lymphedema, maybe we should reconstruct those lymphatics. So now we're reconstructing these like, sub-millimeter, vessels together and putting them into veins and saying, okay, we're going to give this lymphatic fluid another place to go. And that kind of thought process, to me, just like epitomizes this idea of like creativity in plastic surgery.
Mhm.
And I think that microsurgery really kind of like provides you that tool to be like, okay, go be as creative as you want to be to solve like the most complex problems. And that's what I love about microsurgery. I think it's just so every problem is so interesting. And I love thinking about it. I love managing it. And, I think that that's ultimately kind of what I want to do. I ultimately want to have a practice and, general reconstruction, where we can treat, a lot of like bread and butter plastic surgery problems, but be able to then face complex problems. Patients who may need, for example, like a flap in a very difficult place, may need, a reconstruction that's not so that maybe it's never really been done before, but we kind of have to think about a solution, know how to like manage vessels, know how to manage that anatomy in a way that kind of optimizes that patient's outcome. And I think that that's to me what's, so exciting about kind of this field and particularly this kind of like subfield of plastic surgery.
It's so fascinating. I really love that. And one thing I like about what you're saying is I feel like with surgery, a lot of times you don't get to use your brain as much because it's a lot of just like repeating motions that you've trained very like intensely to know. But I love with plastic surgery that you really get to think about each procedure and like make that whole plan, like you're talking about, kind of from scratch and really using all the things you've learned about to create a tailor-made plan to that patient. I think it's a very great mix of like using your brain and then also doing the surgical technical skills that you've learned. So I think that's
Yeah.
fascinating. If do you know like what your tenure or career plan would be with microsurgery?
Yeah, that's a good question. Ideally, I'd love it to, be doing, general and complex reconstruction. I love working with residents. I love the idea of, education of plastic surgery. So I'd love it to be in an academic setting. So, basically, being an academic microsurgeon would kind of be like my ideal career goal at this point. And being able to kind of like do a range of plastic surgery, from a very general, bread and butter plastic surgery to very kind of complex reconstruction when needed. And being able to like have the tools to, feel comfortable with whatever kind of problem may come my way is kind of, my ideal setting. And hopefully again in an academic setting. I love I love residency programs. I love our society in general, both with the American Society of Plastic Surgeons, but also with the American Society of Reconstructive Microsurgery. I think that's, just a
Mhm.
phenomenal, organization. And I'd love to kind of like be more of a part of that in the future.
That makes sense. Well, this has been absolutely fascinating. I do have one more question to kind of end us off here. If you could go back and give advice to your younger self before starting medical school, what would that be?
Oh, I think that when we start medical school, we all like everyone's very apprehensive. It's like, oh my gosh, like it's everything is just so much. You're kind of like they say you're drinking from a fire hose, at the beginning of medical school. And it's just like it's a lot. It's a lot. And you don't
Mhm.
I feel like, oh my gosh, at least for us, like we had, New York Medical College, I think it was a very testing oriented environment. It's like they have all these grades, they have all this information. It's a lot, and you're like, man, how am I gonna get through the next month or two, and then figure out I got to apply to residency. Wow, I remember thinking residency is this like elusive, like, oh my gosh, you don't even know what this is at that, when I started medical school. And I think that we just have to remind ourselves that it'll be okay, that this is a
Yes.
process for a reason, that we have to trust the process, that we're here for a reason, that you're starting medical school, for a reason, that you want to be a doctor for a reason. And as long as you like, work hard, you push yourself, it will work out. And if, something doesn't work out, try again, and not everything is perfect. Not everything is linear, and that's okay. I think that, we all, to some degree, or at least I do, go through go through that time, and even this time, with a sense of like an imposter syndrome, like, oh, am I supposed to be here? Am I smart enough to be here? Am I good enough to be here? And I think that, after asking myself those questions for like so many years, I've kind of like developed ways to like cope with them, of like, oh yes, here's why, Lana, you should be here. You should be doing this. But it's always those questions, always arise. And I think that, they can be hard to deal with. And I think that it's important to kind of like, remind yourself, that you are of value, and that you can do this, and that you're meant to do this, and that, and to remind yourself, like we talked about before, that humility is a good thing, that questioning yourself and constantly striving to do better, and kind of try to like make yourself the most perfect version of yourself is a good thing. But to not let that detract from, the value that you see in yourself at the same time. It's a hard balance to strive for, but I think it's an important one. And then I think that the last thing is to just that, you can do it all. You know what I mean? I think that people come to
Mhm.
medical school and like, people are like, oh my gosh, I remember I don't remember where I heard this, but somebody was like, "Oh my god, if I were to get pregnant and have a baby at the beginning of medical school, I would die. Like I would never be able to like have a baby in medical school. Like my career would be over." And I remember like thinking about it, I'm like, "What are you talking about?" Like not like I remember one of my best friends from medical school was also a JOMA member, had her like first baby, like the second week of medical school, and then just
Oh
like
my God.
and then crushed the rest of medical school, and then had another child and just did extremely well, and, like, has, like, 2 more children, and just it does so well, and I'm just like, "You can do it all. You can be, a mom and a doctor and a surgeon," and,
Mhm.
you just have to find a way to do it. You have to just find your support system. You have to want to do it. You have to, create the time in your life to be able to dedicate it to all the important parts of your life that you wanna do, but if you wanna do it, don't let that be a barrier to you. You absolutely can. I feel like people kind of have that fear going in. They're like, man, I really want to have a family. I want to be a mom, but how can I do this all at the same time? You can, you just you have to just make it happen and just create those systems in place. And you have to love medicine and love surgery enough to want to balance that with your family.
Yeah,
And as long as you do, then you absolutely can be something that you can do at the same time.
that is amazing and so inspiring. I agree. I think it's very hard to see how that can happen. So it's amazing to hear someone who's actually doing that. So thank you so much for sharing all this with us. This was a great just peek into what your life is like as a plastic surgery resident and what you aim to do. So thank you so much for joining us and thank you.
Thank you for listening to the JOMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@joma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.